Cool. This is great to see. Thanks, everyone. So I'm Hannah Wade. I work at the Congressional District Health Dashboard. Um, we're based out of NYU Grossman School of Medicine in New York, but our dashboard provides data for the whole country. So you'll see a couple of us from the New York area, and we're familiar with it, but also happy to provide data for the whole country. So I'm joined by my colleagues here today, Dana Duong and Ben Spoor. They're here to help us answer your questions and respond in the chat and help this move along. We're excited to be talking a little bit about our Medicaid enrollment data today because that's been our latest update to the site. But we're also going to do a general overview for anyone who's joined and is new to the dashboard. If you have questions at any point, you can put them in the chat, and I'll end the session after we do the demo with a live Q&A, and we're happy to answer any questions that you have. Great. I'm just checking the chat again because it's so fun to see where people are from. Okay, cool. So I am going to get started. I already have my slides up. I hope everyone can see them. Great, thanks, Dana. So for those of you who are new to the dashboard, until now with the dashboard, rigorous nonpartisan data on health and conditions that affect health have not been widely available at the congressional district level. So starting in January 2023, we launched the dashboard to help address this challenge. That was also at the start of a new Congress. So it was a great time to launch the tool. Our goal is to provide granular data at the district level that is straightforward and unbiased, as well as trustworthy, to help inform and catalyze priority setting. Data can illuminate challenges and assets in communities that might otherwise be hidden. Data can inform effective policy solutions and really show that, what might work in one community might not work in another. And data can also be held to hold leaders accountable to ensure that they're living up to their commitments and responsibilities. The audience of the Congressional District Health Dashboard really includes elected officials and their staff, folks on the other side, advocates on the other side of the table, journalists who can help bring attention to challenges that we're facing, researchers, and citizens in the general public. Our work with the Congressional District Health Dashboard builds on our experience developing and leading the City Health Dashboard, which similarly provides health and health-related data for cities across the country. So what does the Congressional District Health Dashboard measure? We have 40 metrics on our site, and they span from health outcomes to social and economic factors, health behavior, physical environment, and clinical care. I have Medicaid enrollment highlighted under clinical care since we're going to be talking a little bit more about that today. Our metrics are drawn from federal data sources and other data sets that adhere to rigorous standards of data collection and analysis. Some examples of these include the U.S. Census Bureau, the Centers for Disease Control and Prevention, and the Environmental Protection Agency. On our team, we have population health and policy experts, epidemiologists, and geospatial specialists that work to regularly update the dashboard with new years of data, new measures, and relevant resources to help folks navigate these the site. So getting a little bit more into our measures, I mentioned that they're from national data sets. It's one of our standards, is that we want to make sure that data is available for the whole country when we add it to the site. We employ rigorous methods for looking at underlying original data collection. We want to make sure that the data that we're putting out there are reliable. We want all of our measures to reflect public health priorities, and we're always looking at, that can be a changing environment. We're looking to make sure that we're, adding relevant measures. We update the site with new data annually. And for Medicaid enrollment, we do it twice a year. And then I did mention the different domains. We try to balance measures across domains of health. So you're looking at, what are actual health outcomes and also what are various factors that drive health. Just highlighting from August, we added 3 new quarters of Medicaid data, which brings data available on the site up to earlier this year, which is really important for everyone across the country in these times where we're looking at major Medicaid changes. We provide the percentage of individuals enrolled in Medicaid at the congressional district or state level by quarter. So you're able to see how things change over a little, for 3-month periods. The data source for Medicaid is the Centers for Medicare and Medicaid Services. So states report to CMS, and then we're able to use the data from CMS to provide it at the congressional district level. This is our sort of launch page for going to our website demo. I just want to pause and see if there are any questions in the chat before I move over to the website. Dana, are there any questions for us before we start the demo?
No questions.
Okay, great. Thank you. So before I jump to the website, I just want to call out our funder and partner, Robert Wood Johnson Foundation, and then also the Bipartisan Policy Center and Center on Budget and Policy Priorities were partners that helped us really shape the dashboard and try to make sure that it would meet users' needs. We're excited to share this with you today and also interested in your feedback and questions. So without further ado, I'm going to try to launch over to the website. This is our landing page at congressionaldistricthealthdashboard.org. This is kind of the launch pad for exploring the Congressional District Health Dashboard data. You can start by selecting a congressional district or state from the dropdown. We have everything here, plus DC. I saw a DC person from the chat, so just calling that out for you. You can also enter and find a member by typing in an address or zip code. And I know probably many of you are familiar with really interesting district lines. You might type in a zip code and get, multiple members for that, and it'll help guide you the same way other resources, the Find My Rep resource. So I think we'll start with, we're just going to go over all of these different areas, which kind of cover how you explore the website, how can you explore the data. So we'll start with health snapshots. And I think I'll just click on that, and then it's going to prompt me to enter in a district. I'd love to pull one from the chat. We're going to use Arizona 3rd because I'm seeing it there. So our health snapshots feature provides all of the measures for a district across all of the metrics that we have on one page. So for all 40 metrics, you're able to see how Arizona 3rd is doing. And then you're able to compare it with this visual tool in the right column to the national average. So I can see that Arizona 3rd is around the US average for air pollution, and hover to see the actual number here. This is a really useful tool if you're just wanting to get, kind of an overall snapshot of what's going on in a district. And I can see that because of the green circle that Arizona 3rd is better than the US average for high blood pressure in the district. We like to use this, we like to promote this tool for anyone who's thinking about you know, providing kind of like a printout or an overview for a particular district. You can go to print page and get the whole thing in like a nice PDF printer friendly view. You can also filter by domain or by specific metric, and then you'll only get those metrics. So it's really helpful if you want to sort of zoom in on a couple measures that are of particular interest to you. I'm also going to take a moment to click on our district facts page. So for every district, we have the population by age and population by race and ethnicity. So some demographic data available for the district. You can also scroll down and see nearby cities that are maybe overlapping with the district, and you could click over to our City Health Dashboard website to see what the data is available for that city. And then scrolling further down, we've got the reps and the senators for that district. So nice information about the district as a whole. If you're interested in kind of starting with, I know I want to look at one issue and I want to see how there's geographic variation on this issue across the country, you can go to a different window, which is metric maps. I'm just kind of navigating along the top here. And I'm going to pick Medicaid enrollment since that's what we wanted to focus on with you all today. And this will immediately take you to the national map for Medicaid enrollment. And you can explore by entering in a specific district or state here, or you can just click around the map, which is often what I'm doing. So once you hover and then click, it'll pull up what the measure is for that district. Another thing that you can do from this national metric map window is change the metric time period. So you can see for Medicaid enrollment data, we have a lot of quarters of data available. You can download the map and scale bar that you can use then in presentations or other materials that you're creating. And then I'll just show you an example of, what happens when you click through, say you're like, okay, I really want to zoom in on Massachusetts, for example. So I'm going to click on Massachusetts. I'll go ahead and zoom in just so you guys can kind of see how things take a second to load, but then you get there. And then, I'm clicking on View District. I want to look a little closer at what's happening in Massachusetts. Maybe you have some colleagues that you want to work with in the state. And you can see that there's pretty sort of across the whole gamut of enrollment in Medicaid just by looking at the colors. And then you can start to click around and see what variation you have statewide. That is, I guess there's one other thing I want to show you here, which is that this sense-making statement at the top gives me kind of like, this is what it is. It puts this data, this number into a sentence so that you can help communicate that with others. If I change this to the state value over here, then that's going to update this sense-making statement, the scale bar, to the state comparison. So again, depending on who your audience is, who you're working with, maybe you want the national comparison for something, maybe you want the state. It'll update those resources for you. So as you're exploring it, you can understand it better, but also if you want to share this kind of stuff with other people, you can, change the resources for them. I don't think I mentioned this in our metric overview, but so we have all these 40 measures. For some of our measures, we do offer demographic data if the data is available in the data source or if it's appropriate for that measure. I don't want to pick on Arizona 3rd. I want to pick another district from our group. We've got New York 3rd. So just to kind of walk you through what we have for demo data. This this automatically shows you what metrics we have available for demographic data. If it's, if you can click on it, then we have demographic data available. If you can't, then it's not available for that measure. I'm going to go to children in poverty for this one because I believe we have two different types of one type of demo data available for children in poverty. So we have the race and ethnicity breakdown. So you can see for New York's 3rd congressional district, the different rates of children who are living in poverty by race and ethnicity. This is another one where you can, change the metric time period. You could even say, hey, maybe I want to look at a different metric. I'll go to unemployment. And we have the sex breakdown, race and ethnicity, as well as age. So you can really see a lot of variation when you start to dig into the data a little bit more. I think that's it for metrics by demographics. Can I pause to see if there are any questions in the chat?
Yes, there is one question from Ashley. She says, you mentioned twice a year updates to the data on the site. Approximately when each year are those updates made?
That's a great question. So we do an update in February every year, and we just did the August update, which I mentioned included a Medicaid data update. But all the other metrics get updated in February. And that's really in part to align with a new Congress and new geographic districts. So we don't just update the measures, we also look at, I'm sure you all have seen redistricting in the news, but we'll look at, what states have redistricted and what also needs to be changed for folks so that we can have the latest data available for the current Congress. So our last kind of major way of exploring data is this compare districts tab. I'm once again going to pick on Medicaid enrollment since we wanted to talk with you all about that today. And we're going to start with one congressional district. I'm going to do New York 16th because I see you in the chat. And this is really another visually friendly tool to explore and compare data. So I say I want to look at multiple geographies at the same time, and maybe they're not adjacent. Maybe there's a reason why I want to look at Arizona 3rd and New York 16th and sort of see how those compare. Or I want to add, the state. And you can see as I've been typing these in, we're pulling up what we call cards for each of those districts or states. And then it's also populating a scale bar here. So we have the national scale bar and then New York 16th, Arizona 3rd, and then the state of New York. And you're really able to see a lot of variation pretty quickly. And then like with our health snapshots, you can do this print page feature and you'll get, a nice printable PDF. The graphics are not there, they don't break between the pages, so you can use them in presentations or printouts. I think that might be all I want to point out about the functionality. I know I missed one thing under metric maps that I'll circle back to now. I'm going to zoom in and just want to point out where we have census tract level data available if you are zoomed in on a specific district. And again, if that data is available at the census tract level for that measure. So children in poverty is one where we have census tract data available. And when you're in the district view, you can click on show census tracts. And then you can really start to get into neighborhood level variation. And I think this can be important when you're thinking about how do we best serve our district, or, what are the issues on the ground throughout the district, not just sort of the district-wide average. Thinking about, what neighborhoods are in need of services. This can really help illuminate some disparities within a district. Great. I think I'm pivoting over to a couple of sort of like extra tools that might be useful to you as you're navigating the site. For every metric that we have a metric background, which provides information about the data source for the metric, why we measure it, what is the connection to health, and then some, background information for those of us who really need to know, how is this calculated? Where's it from? What's the data year? I know that's important for all of us, especially as we think about reliability and trustworthiness of data. We want to know where it's from. So we provide all that information for you, and you can always reach out to us if you have questions. And again, for those who are more interested, they want to do more with the data than just kind of look at it on the website. You can also download the data. It's fully available here through this tool that we have, where you can, select the metrics that you want, the geographic level that you want, and then download a CSV file. We also have the sort of by state option. So say you want, all of the metrics or select metrics for Arizona, you can do that. And that really just gives you direct access to the data that you may need if you're working on an analysis, or maybe trying to create your own visualizations. Great. I'm seeing a question in the chat, and I'm also kind of ready to pivot. Yes, I can show again how I access the current page. Thanks for asking that. I moved kind of quickly. So in our menu bar, I went to access the data, and when you go to this page, it actually requires you to submit a form. I filled it out earlier, so it's not asking me to do it again, but it just asks you for your email address, your name, and I think your zip code, and sort of, why you want to use the data. It gives you a couple options, and that just really helps us to, on our end, kind of know, why do people want to use the data, and is this worth it for us to keep providing it? Sometimes it's, we're looking for opportunities to share with the world, how are other people using the data, and it's just helpful to us to be able to track that. So this is the page that you get to after you fill in the form. I'm seeing another question in the chat about, do you have data specifically for rural versus suburban and urban, rural, urban, suburban areas? We are actually in the process of updating a tool that will allow users to look at what are some variations between districts that are more rural, more urban, and more suburban. We created this for the last Congress, and we've updated it for the current Congress. So that is coming soon, and Christopher, we can follow up with you and send you an email when it's ready. But for everyone here, it'll be, posted on the website and under our blog and media section once we've got it up to date. This is a great, just also showing you this now under the menu. You can click on blog and media, and that's a good way to kind of find out what's going on with us, what new data do we have, what new features and updates. And then, of course, you can really stay up to date if you subscribe or follow us on LinkedIn. I'm opening the floor for live Q&A fully. I know I've been answering some questions from the chat, but happy to talk more about anything I went over too quickly or go back to something. And also feel free to come off mute and ask your question if you don't feel like typing it out. Dana, would you mind putting some of the links that we've been talking about in the chat? That'll be I think just the link to the site, and then our email address, if you want to reach out to us, is info@cdhealthdashboard.org. That's our team that triages those questions and answers them. You'll talk to a real person if you email info@ the LinkedIn link, and then a subscribe link as well. Christopher, I see you've come off mute. Are you gonna ask a live question?
I am, if you'll let me.
Yes, of course.
So do you have tables that indicate trends? Can we take pure data and somehow ask it, what has been the change, for example, since the expansion of the 1332 expansion of New York State Medicaid in 24, whenever we did it, 22, I don't remember. Do you have that kind of data available?
Yeah, so you can certainly look for it on here. I think you're from, you said New York, you're New York 16th, right? So if I wanted to look at New York 16th over time, the manual way to do that would be to go in here and just click across the different quarters. This is like the non-tech savvy way to do this, right? I'm just looking and I'm seeing the change over time. Maybe I'm going back to the earliest time period where we have data and seeing, fourth quarter 2022, that's 26.7%. And now we're down to 23.5% in the district. The more data savvy way would be to do it the way that I was talking about with access the data, where you would come in here and get your CSV and then, use Excel or whatever tool that you'd like to look at trend over time. I will take a moment to say that not all data is appropriate for trend over time, and we do provide some guidance on that in our tech doc. So for folks who are interested in looking at doing more analysis, there's some guidance in there. I would like to ask Ben if there's anything you'd like to add about the trend over time or analysis type of conversation.
Yeah, it's a great question about trend over time. There's a couple things to think about. One is we don't provide tables. I believe, Christopher, you asked specifically for tables. We don't provide tables that track the change in, for instance, Medicaid enrollment back to the expansion or further back in time. I saw another question in the chat from Ryan. Are we going to go back further than 2022? And so I'll take both simultaneously. Right now, we don't have plans to go back further than 2022. Usually what we have done is provide data that tracks the metrics for which we provide estimates over the course of the current congressional term. And then when the congressional term updates, we update the data. But it doesn't mean it has to stay that way. Ryan, yours is the second question that sort of makes me think maybe we should provide data further back in time. And certainly for many, not all, but many of our metrics, the data are available for us to provide data further into history. And there are compelling use cases for seeing how enrollment, for instance, has changed since expansion, to borrow an example, or others. So, if that's something that would be useful, you should definitely email us, and then we have like documentation of user requests for this thing, and then we can make a pretty compelling argument to our stakeholders, our internal stakeholders, that we should have it. And then you'll also see that for some of our metrics, we are able to provide data further back in time. We've stopped at 2020 for this one, but if you're looking for something further back in time than that, just let us know and we'll see what we can do.
Thanks, Ben. Are there other questions that kind of came out of that answer and what set of questions? in a similar vein to what Ben was saying about really, essentially user feedback or questions from users, use cases about, I could really use this type of data or this type of approach. I mentioned earlier that we have our City Health Dashboard site. On that site, we provide the opportunity for users to compare metrics in the same geographic area. And that is something we've explored for Congressional District as well, in case that's something that you want to chime in about. Yeah, Christopher.
Just to provoke Ben's thoughts a little bit, we're coming into a time where we expect rapid disenrollment from Medicaid. We just went through the whatever they call that, the
Unwinding.
Mm-hmm. And it seems to me that the trends over time become incredibly important to be able to see what's
Mm-hmm.
going on, to make it simpler for us to get them. Makes it easier for us to understand exactly what's happening to our districts.
Mm-hmm.
Not that necessarily will make my district person more responsive, but still I need the data to show that what's happening over time.
Yeah, we were recently working on a newsletter that Dana put a lot of work into, especially that was going to show some trends in Medicaid enrollment over time. And the conversation we had internally was that if we show the last couple of years on a line graph, and it shows a decrease in enrollment, we don't want to put out into the world a potentially uncomplicated narrative that Medicaid enrollment is declining because people don't need Medicaid as much, right? What we're really seeing is that we had this huge expansion in enrollment due to a specific policy change during COVID, and now that policy, special policy window is closing. And what we found looking at some other websites that provided data further back in time was that we're not decreasing to new low levels, and there's not a decreasing need for Medicaid. It's that we're returning to a level of enrollment that was not perfectly steady, of course, but more or less steady prior to the pandemic and this special policy moment. So we also want to be really conscious that the data we provide gives people everything they need to understand the whole picture. And we'd have to really think about how far back in time we would need to go, partially to Ryan's question, to give people a full picture that included this sort of pre-COVID era, the increase in COVID, and then what we think now is a decrease back to this sort of more steady state situation we were in prior to COVID. And then whatever changes will result from the one big beautiful bill. So you are provoking thinking. We're thinking about it a lot. And I don't know how far back in time that specific data source goes. It could be that it has all the years that we need. It could be that it's limited. And we'd have to do a lot of work into verifying the validity of the estimates prior to, we'd probably want to go back to like 2018, 2017. And my guess is those numbers are good, but we'd have to check. So to your point, Christopher, I do agree that it would be interesting. Another thing we've thought about is whether or not we should provide on the website estimates for the previous year's geographic boundaries or the previous congressional sessions geographic boundaries, so that when boundaries change across congressional sessions, one can get a live and direct understanding of how those boundary changes alter our metric estimates. So we have been thinking about it, and we'll take your feedback into consideration. And to anyone who has thoughts but may not want to quite appear on camera as Christopher was willing to, you should definitely send them in, because that all of it provokes thinking for us.
Thanks, Ben. I think a little more on the geographic boundaries, as we're talking about, what data is available, I do want to share, I'm sharing my screen again, just as an example. Christopher, you're well aware of this, and other folks in states that redistricted in the last sort of twice since the 2020 US Census, even are probably familiar with changes across their states. What we've provided on the website to allow for continuity is that even though the 2020 data would have been taken at a time when the districts were different, it is provided at the current Congress geographic boundaries. So when you're looking at 2023 data for New York 22nd, and then you click back and you want to look at 2022 data, you're still going to be looking at the current New York 2022 boundaries. And that does help with comparisons over time. So you're not comparing, different populations. Are there other questions for us today? Well, this has been a really great session to have with you all. Thanks for the interesting questions in the chat and coming off video. It's nice to connect with people. If you'd like to connect with us more, please feel free to reach out. We've got the active LinkedIn and our email info@cdhealthdashboard.org that we are checking daily, and always nice to talk with folks who are actually using the site and trying to figure out how to navigate it. So yes, Shelley, I see your new question in the chat. So you're always going to see current district boundaries even when looking back when districts were different. Yes, that's correct. And if there's a reason why you'd want to see it differently, reach out to us. Let us know. We are thinking about it, as Ben mentioned. Great. So there's some resources in the chat. Feel free to copy and paste those for yourself. Thanks again, everyone, for joining us today. We appreciate it. We'll send a link to the recording and the slides after, so you can have those as a resource as well. Thank you. Have a great day.